I absolutely love thumbs. Is that weird? I think that's a bit weird, isn't it? I think that's a bit weird, yeah. But anyway, that's okay. Um, Thumbs are great because we never used to have a really good option for treating thumbs as a hand surgeon. It was always take the bone out at the base, shove some steroid injections in, use a splint, send them off to the physio, and nobody was ever really very happy. The steroid injections can work into the joint, and you see them again in 6 months or 9 months later, and then the next one works for about 3 weeks, and then the next one works for a few more weeks. It's not very pleasing. But now we have joint replacements. They're amazing, and they're like a little mini hip replacement. They're about this big, top to bottom, and one bit goes into this bone of your thumb, and one bit goes into the base of the thumb, the bone at the base of the thumb that's causing all the problem, called the trapezium. Funnily enough, it looks like a trapezium. And this new joint called the Ellis, which is from a company called Besnoska, but there are other ones like the Touch, which is from Kerry Medical. And there's another one called the Maya from Groupe Lepine. Interestingly, both French companies, and Besnoska's from Czech Republic. For some reason, lots of European countries seem to have lots of innovation. We don't seem to have much in the UK, but anyway, I'm sure we have some in the medical field. We tend to distribute everybody else's products, but the one I use, the Ellis from Besnoska, absolutely amazing, love it. Patients come back at 2 weeks and they're going, yeah, no, thumb's fine. What do you want me to do? Oh, you want me to put them in a splint again? I'm not going in a splint. And it's only 2 weeks after surgery, which is absolutely incredible. Considering what we used to do, which is take the bone out at the base of the thumb, the trapeziectomy, ectomy just meaning take out, trapeziectomy, or trapeziumectomy is taking out the trapezium. And we used to do that, and it worked okay. But these joint replacements, patients are so happy. So again, as with all of my posts, you don't have to live with hand pain. It's just not an absolute. Even if you're 90, it doesn't matter. You don't have to live with hand pain. So please, 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 promise me, I'm going to get strong with you, promise me you won't live with hand pain. Come and see me.